Some of the things that the patient should be asking the doctor after he's been diagnosed is, well, what do I do? What are the treatment options? Should I be treated aggressively based on my biopsy, which showed that it was low risk? And also, if it's high risk, what should I be treated with? And if I'm having surgery, how long am I going to be in the hospital? When can I go back to work? Will I have a lot of pain? Will I have a leakage of urine? I've heard about that from others. And what about my sexual function? That's important to me. Those are the kinds of questions that he should ask. The doctor should start off by telling the patient, particularly he's African American, that he's at higher risk in other populations. The incidence of prostate cancer in African Americans is 60 to 70% higher than other populations. And the death rate is 2 to 3 times greater than other populations. So based on that, he should know that the cancer is probably more aggressive. And in fact, it's been published that the cancer grows faster among African Americans compared to European Americans. Now, the question is treatment. If you're my patient, I would recommend aggressive therapy if you're African American and if you're younger than 70. If you're older than 70, perhaps a less aggressive treatment. Those treatments would be surgery for the aggressive treatment and non-surgery for cancers that are not so aggressive, such as radiation therapy. However, it is the patient's choice. It's always his choice whether he wants to have surgery or radiation therapy, regardless of what I tell them or what the physician may say to them. It's their choice. If they have an aggressive cancer and choose to have radiation therapy, that's their choice. But it has been shown that men who have surgery versus radiation therapy, at 5 years, there's no difference in the outcome in terms of recurrence of the cancer. But at 10 years, it's been found that men who've had their cancers removed by surgery have a better outcome than those that have radiation therapy. Now, in terms of leakage of urine, yes, that can happen in surgery. It depends on how aggressive the cancer was, how extensive the surgery has to be in order to remove it, how incontinent they may be. It also depends on the skill of the surgeon. In terms of sexual function, what I can tell you is that with surgery, immediately there's the loss of sexual function, but it improves over time. It may require therapy. In men under 65, generally it returns quicker. And men over 65, with therapy or without therapy, it may take longer. Now, in radiation therapy, the leakage problem occurs later, where you may have to go to the bathroom frequently and have a wetting on yourself before you can get there. Those are the kinds of things that may happen with radiation therapy. In terms of sexual function, you start out with your normal sexual function and it decreases over time after having radiation therapy. Some other issues that the doctor may need to discuss with you, that is surgery or non-surgery or non-treatment. Patients who have low-risk cancers, those patients who have a Gleason score 6 and possibly Gleason 7 with favorable risk factors. Also, those patients who are reasonably healthy, active surveillance could be considered. Now, active surveillance means that they're going to watch it closely, but with the intent to treat. There's watchful waiting, where we also not treat. Generally, these are people who are older, who have several health issues. Those are people we watch, but don't intend to treat unless they have symptoms that suggest they may have metastasis. Those patients may be treated with medicines just to control the pain or improve their quality of life. Also, I want to say that the patient may have an extensive cancer, maybe an aggressive cancer, and the patient may need to know that they may need to have multiple treatments, such as surgery, followed by radiation therapy, followed by hormonal therapy. So that's in patients who have an aggressive cancer, and the doctor should be able to identify those patients. Also, one other thing that the doctor should tell you, it's mentioned in the media that 1 out of 8 men will have prostate cancer in a lifetime. However, for African Americans, it's 1 out of 6 men will have cancer, prostate cancer, in a lifetime. So how can patients get access to the best treatment? I recommend the patient, if he's computer literate, to go online and find out a lot of information about the disease and the treatment of the disease. Also, you can go online and ask American Cancer Society to tell you what they think is the best treatment options for the stage of the disease that you have. You can go to the CDC and also the National Institutes of Health. You can also get a second opinion if you're not happy with any of that information, to get clarification of that. And often I tell my patients, get a second opinion to find out.